Welcome to the IRF and LTCH virtual training program. My name is Lisa Newton, and I'll be presenting the training program overview, which focuses on the expectations for each of the training components, Part 1 and Part 2. I'm a registered nurse with experience in direct patient care, clinical education, and executive level administration in both the acute care and LTCH settings. Currently, I'm a senior staff associate at Econometrica in Bethesda, Maryland. Let's begin with an understanding of the objectives for this session. At the conclusion of this training, participants should be able to understand the design of the IRF and LTCH virtual training program, Part 1 and 2, describe the framework for the standardization of patient assessment data elements in the post-acute care or PAC setting, and summarize the training and implementation objectives for your facility related to the new and revised guidance. I'd like to take a moment and review the disclaimer for this training. The presentations in this training were current at the time they were published or uploaded onto the web. Medicare policy is subject to change, so links to the IRF and LTCH program web pages have been provided as supplemental resources for your reference. This training program was prepared as a service to the public and is not intended to grant rights or impose obligations. The training content may contain references or links to statutes, regulations, or other policy materials. The intent of the information provided is to be a general summary and not to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. Next, let's review the structural design of the IRF and LTCH virtual training program. It is highly recommended that this overview presentation be reviewed first. The overview provides a basis for your understanding of the entire program and contains foundational material that is not provided in other presentations in the training. Reviewing this material first will provide you with key insights that are necessary for a more complete understanding of the program content. The IRF and LTCH virtual training program consists of two components. The first, Part 1, is a series of recorded presentations that provide the didactic component of this training. An explanation of the new and updated guidance for the IRF-PAI version 4.0 and the LCDS version 5.0 is presented. Item intent, rationale, steps for assessment, coding instructions, and coding tips for select data elements are also explained. These presentations are available for review at your own pace and can be viewed as many times as you would like. It is essential that the presentations in Part 1 are reviewed in advance of attending the coding workshop sessions in Part 2 of the training program. Here is a list of the recorded presentations that provide the didactic component of this training. As noted, we recommend that the overview presentation be reviewed first. The other presentations include social determinants of health and new revised items A, B, and D, Section C, cognitive patterns, Section D, patient mood interview and total severity score, Section GG, summary of guidance changes, Section J, health conditions, Section K, swallowing nutritional status, and Section H, bowel and bladder, Section M, skin conditions, Section N, medications, new item and revisions, Section O, special treatments, procedures, and programs, and the case study. We also recommend that the case study be completed last, as it provides you with an opportunity to apply the coding concepts presented in the other recorded sessions, and the remaining presentations may be completed in any order. Part 2, the second component of the training program, is a live virtual event consisting of a series of coding workshop presentations corresponding to the training topics presented in Part 1. During this event, you'll have an opportunity to apply concepts related to the new and updated guidance for the IRF-PAI version 4.0 and the LCDS version 5.0 by reviewing a variety of clinical coding scenarios and responding using a live polling format. In addition, a recorded version of each coding workshop presentation will be made available for your review and reference after the initial workshops are held. This is a list of the coding workshop presentations that will be reviewed during the live virtual event. As I noted earlier, these topics correspond to the didactic recorded sessions in Part 1 of the training program. Part 2 of the training program does include 2 additional sessions, the question and answer session, which will be based on questions submitted from providers, and the listening session with CMS. Let's move on and talk about one of the foundational elements of this training. That is an understanding of standardized patient assessment data elements, what they are, and why they are important in post-acute care. The basis of this is the IMPACT Act of 2014. The IMPACT Act is also known as the Improving Medicare Post-Acute Care Transformation Act, which is its formal title. This is a bipartisan bill that was signed into law by President Obama on October 6, 2014. This act requires the collection and reporting of standardized patient assessment data with regard to quality measures and standardized patient assessment data elements across post-acute care. As you may be aware, each PAC setting uses a different data collection instrument. Here we see not only the IRF-PAI and LCDS represented, but also the minimum data set, or the MDS, for the skilled nursing facility setting, and the outcome and assessment information set, or OASIS, for the home health setting. Historically, the post-acute care settings collected similar information on their respective assessment instruments. However, variation between settings has made cross-setting comparisons and interoperability of data difficult. This slide demonstrates this concept by depicting different types of fruit for each PAC setting. So for example, the item eating has been assessed in each setting, but done so differently. The collection of data in a standardized manner facilitates outcome comparison, data interoperability, and comparison of quality within and between PAC settings. Here we see the example of the item eating that is now collected in a standardized manner in each PAC setting, represented uniformly by the same piece of fruit. Standardization is very important for a few reasons. It enables cross-setting data collection, outcome comparison, data interoperability, and comparison of quality within and across PAC settings. Standardization also improves outcomes for Medicare beneficiaries through shared decision-making, care coordination, and enhanced discharge planning. So what does this mean in relation to the IRF-PAI version 4.0 and LCDS version 5.0? Well, new and revised data elements are being implemented in the IRF and LTCH settings toward the ongoing goal of standardization and cross-setting alignment, and these changes will become effective on October 1st, 2022, with the implementation of this new guidance. In addition to the standardized patient assessment data elements, several other changes have been made to the IRF-PAI 4.0 and LCDS 5.0. Content has been updated with gender-neutral language. Minor updates were made to the wording to enhance understanding. Coding examples have been modified to improve clarity. The acronym keys was changed to I-keys in the LCDS manual, and references to the LTCH CARE Data Set were simplified to LCDS. Throughout the IRF and LTCH virtual training program, we've established and used a variety of conventions to enhance the training. Let's review how these can be helpful in guiding your review of the material. First, all the acronyms used throughout the presentations in both Part 1 and Part 2 of the training are available in a companion PDF that can be downloaded from the training platform and used as a reference throughout the program. Also, throughout the presentations, different formatting conventions are used to identify changes to guidance. Blue text is used to identify guidance that has been revised, and blue strike-through text is used to identify words or short phrases that were removed from the guidance. And on the last bullet on this slide, we have an example of both conventions being used to demonstrate this. Reference icons are strategically placed throughout the presentations to assist you in more easily understanding how to apply the content. A star-shaped icon with the word new in the center is used to indicate that the guidance on the slide is new. We also use setting-specific icons to identify whether the new or revised guidance is applicable to a specific setting. Throughout the training program, coding scenarios, examples, video vignettes, and a case study are used to assist participants in applying the concepts related to the new and revised guidance. For instructional purposes only, gender has been designated to represent facility patients, family members, and staff in the case study and any coding workshop presentations that use video vignettes. We have also provided additional supplemental materials to assist your understanding of the presentations. These materials are available by selecting the respective tab in the event platform. The materials include slides for each presentation, the acronym list, the action plan template, which will be reviewed shortly, documents to complete the case study, the IRF-PAI 4.0 and the LCDS 5.0 item sets, and a list of training resources and links that are specific to IRF and LTCH. Now let's talk about how you can make this training as meaningful as possible for your specific facility. Action planning is one way to help translate the training materials into action steps for your setting. We've created an action plan template that corresponds to each section in the training. You can use it to take notes and record your thoughts and ideas and identify processes that may need to change at your facility in response to the new or revised guidance in the IRF-PAI version 4.0 or LCDS version 5.0. And this may include things like authoring or revising policies and procedures, training and education for your staff, and possible enhancements to information technology at your facility. Here's a screenshot of the action plan. We've pre-populated an example with some ideas to get you started using the tool. The action plan is set up as a template with a separate page for each training session and columns that are blank for your notes. So if we look at moving left to right on this tool, the first column on the left identifies the training topic or session. In the second column, you can list any policies, procedures, processes, or documentation systems and tools that may be potentially impacted at your facility. In the third column, you can record any action steps that may be needed for new guidance implementation. The fourth column identifies any education needed, and that includes both the topic and the audience. And the last column outlines the target dates and timeline for completion. This tool can be personalized in whatever way is most meaningful for your organization, and we hope that you find it helpful. Another way to look at your implementation strategy is to see it on a linear timeline as a series of action steps. So moving from left to right, you would review the finalized IRF-PAI 4.0 or LCDS 5.0 guidance, identify the new and revised data elements and the implications for your PAC setting, identify any impact on IT at your facility, develop an implementation plan to introduce the changes to your staff, and revise policies and provide education and training to ensure facility readiness for implementation on October 1st, 2022. Now let's take a moment to briefly review the Quality Reporting Program, or QRP, training resources that are available to you. The IRF and LTCH virtual training program is based on your new guidance. So either the IRF-PAI 4.0 or the LCDS 5.0 assessment instruments and manuals. Resources for both settings are available by selecting the links on this slide. As noted earlier, we have also provided a resource document for both IRF and LTCH that is available for download from the event platform, containing additional helpful resource links for providers. Beyond this presentation, another helpful resource to you is your setting-specific Q&A that is released quarterly. This is a very important resource to access and ensures that you have the most current information. The quarterly Q&As are located in the download section on the QRP manual page for your setting, and links are also provided on this slide. In summary, new and revised data elements are being implemented in the IRF and LTCH settings with the goal of ongoing cross-setting alignment. These changes will be effective October 1st, 2022. We encourage you to utilize the training materials provided in the IRF and LTCH virtual training program, Part 1 and 2, to assist your staff in preparing for the new guidance implementation. This presentation was designed to provide an overview of the IRF and LTCH virtual training program and help you understand the training and implementation objectives for your facility related to the new and revised guidance. We have covered a lot of information in this session, and you may find that you have questions about the content. If you would like to submit a question, please send it to pactraining@econometricainc.com by June 3rd, 2022. As a reminder, a practice coding workshop will be held in June, and we encourage you to attend that. Select questions will be answered in a Q&A session during the June 2022 virtual live event. Thank you for reviewing this presentation, and we look forward to your attendance at the coding workshop.